Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out, or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I have with me Dr. Jillian Rigert, who is a medical doctor, a doctor of dental medicine, a life and leadership coach, a fellow wellness champion, and an Air Force veteran. During residency, Jillian had a life-threatening illness that informed her path. And she is here today to share her journey and life lessons with our audience. And Jillian, I am so grateful to have you.
I am so delighted to be here, Jen. Thanks for having me.
All right. So let's see. Where should we start? I guess let's just start with you telling us a little bit about your story.
Well, I appreciate it. I won't bore the audience with too much. I think the most pivotal points of where my mission currently is grounded from are my experiences fast tracking my way to become an Air Force oral maxillofacial surgeon and realizing when I was in residency that it probably wasn't the best fit for me, kind of having an existential crisis and numbing myself with an eating disorder that became life threatening at the same time I was dealing with suicidality and topics that are important for me to discuss at this moment if people around my social media are on moral injury and PTSD, because at the same time, I was disillusioned by what it meant to be working in medicine and in dentistry. I lost my ex-boyfriend suddenly, my co-resident died, my commander in the Air Force died, and I had survivor's guilt because I had been dealing with suicidality and I survived. And so a lot of my current mission is to help people who are at these points of career inflection points where
Yeah.
they're wondering, am I in the right career? And also I work with patients with head and neck cancer. There's a lot of trauma involved when it comes to emotional, physical trauma, and also impacts on the healthcare professionals taking care of these patients and their caregivers. So
Yeah. Wow. Okay. So first of all, your vulnerability, I mean, you just dumped a whole lot of stuff out there. That's pretty powerful. And it must be that you've done a lot of work because you just sort of matter of factly just said all of these unbelievable.
Yeah,
So
yeah. And it's right. It's because I hid in guilt and shame and the guilt and shame almost killed me. I just had an article on Kevin MD as unworthiness almost killed me. And I share my story vulnerably and openly because I know for me that it was hearing my story come out of someone else's mouth, or at least resonance of the story, that helped me realize I wasn't alone. And I think a gift of hitting a rock bottom is like, I just don't care anymore. I lost my military career. I left surgery. And I realized that what keeps me going is creating meaning and purpose and helping people to heal and walking alongside them. So if I'm not living it to give it and being as vulnerable as I find to be appropriate in these moments, then I'm not doing the service to others to feel that they can really lean into me and be vulnerable as well.
yeah. So how did no, if you could back into at what point were things good? Like what was the um,
Mm-hmm. Yeah.
the signs?
Well, I think I ignored a few of the things. I questioned whether dentistry was the right fit for me, but I was told maybe it's your confidence. I did pretty well in dental school. I loved our 3-hour appointments because I got to learn all about the patients' lives. The whole arrival fallacy, I didn't love it, but I was going to be an Air Force oral surgeon, so I really wasn't doing what I was going to be doing anyways. I think what happened to me, it wasn't even just the profession. Like I could still love surgery, but it was the compromise of my core values in order to do surgery that led to a lot of instability, and recognizing that no matter what I did, no matter what thought reframing I did, when I was sleep deprived, I just crashed into this kind of deep depression and suicidality. It
Oh,
was the sleep deprivation mixed with the internal stress and external stress and just the
Yeah.
combination. And at the time I wasn't eating enough, so that didn't help. But yeah, I think I was more in the acceptance and realizing that things weren't right when I was in oral surgery.
Yeah. What core value were you totally misaligned with?
Well, when my ex-boyfriend died, I missed his phone call. I was too tired
Oh,
from being on call. Um,
so
so
sorry. Oh
I
my
missed his
gosh.
phone call. I'm sorry. I'll I'll share. I missed his phone call, and I was all right. I'm gonna call him back. He called to check up on me because I was severely depressed, and he knew it. And we've been
Mm.
talking, and just calling to check on me, and was so proud of me. And so he calls me, and I'm so tired. I just took a melatonin. The circadian rhythm is all messed up. So took a melatonin. I was like, I really need to get to sleep. So I went to sleep. I texted him the next day, and then that weekend, I didn't hear back from him, though he left a voicemail, which I still have. So silver
Oh.
lining, still have the voicemail. But his sister texted me as I was sitting in front of this military office about to hear, where I stood with my medical discharge, which was awful in terms of for me because I loved the Air Force. So I was sitting waiting to go into this appointment when I get the text message from his sister. Blake had passed and about the funeral arrangements, and I was in shock. And so I called and his dad answered and explained to me, and I was just in shock. And then like what we do patient to patient to patient, I had to suck it up and
Right.
then go into that Peblo meeting, which is the Air Force acronym. So for the person that was helping me with my potential medical discharge. And so I lost X, losing career in the surgery, losing career in the military, and just like it's this combustion of losing everything at one time. Um, and then so that pivotal moment, and also when I was sitting in the hospital for my eating disorder, I had flown from North Carolina to Utah because other places wouldn't take TRICARE insurance. So like if you're in the
Mm.
military, you
Yes.
can risk your life, but your insurance is horrible. So a lot of
We
places
could
won't
have a
take you.
conversation about that.
Yeah, that's part of my moral injury story. But anyway, so I had this life-threatening level of anorexia, and I go to this residential treatment center and they can't keep me because my heart rate's too low. So they bring me to a non-eating disorder hospital. It's like you need food, like you have, a heart that's malnourished that needs food. And so I was stuck between two places that couldn't keep me. And I was sitting in the hospital waiting to be discharged so that I could then go home and go back to work, is what I ultimately did,
Mm.
ironically. But as I was sitting in the hospital, I was reflecting and I was like, I risked everything in my life, sacrificed everything in my life. And here I am sitting in this hospital alone. Like, what do I have to show for it?
Mm.
Um, and so I was like, I think our society is leading us astray from what matters.
So, Jillian, I can think of quite a number of directions to take this conversation, but I want to throw it out to you. We brought up moral injury, you brought up food as a coping mechanism or not eating food as a coping mechanism, and helping people find fulfillment. What would be most useful to our listeners? Where do you think we should
Yeah, I
conversation?
think I think moral injury is important to mention because I find all of us talk about burnout quite regularly. We hear it. Some of us are burnout from talking about burnout or hearing about burnout without things changing. Not to invalidate burnout. Burnout, is exhausting from the chronic stressors. But I left surgery. I simplified my life, and I was still really struggling. I'm like, this is more than burnout,
Mm.
and we need solutions that really cater towards all of we're going on. So in order to understand what solutions to propose, we're physicians here, collect the data, see what's truly going on, diagnose, like, are we actually providing treatment for the right thing? And it could be a combination of burnout, emotional exhaustion, moral injury, PTSD. And I was really resistant to the PTSD and moral injury because I was discharged from the military in 4.5 years. I never went overseas, didn't deploy. Did that even make me a veteran? And I can't have PTSD. And all that stuff was in my head, you know.
Mm.
And until I accepted what was going on, I was at the VA and I was reading about moral injury. And I was like, this is what the healthcare professionals are experiencing, right? Not only healthcare professionals, police officers, you know, a lot of people just in our world today, people that might have been sexually assaulted, like as I explored more, I'm like, we're not really discussing this enough about what it means to be human in today's society where a lot of our values actually don't align with our moral values. And in medicine, day in and day out, we're potentially compromising those values in a system that isn't catered towards the healing that we thought we were there to provide. And then we also don't have time to process that.
Mm-hmm. Yeah.
And that's, yeah.
I think sometimes people don't even realize that that's what they're suffering from. What find are early signs for people like an indicator to, reach out. I mean, you reached out for help a little on the late. I'd love to hear how you did heal yourself, but how do you get there?
Yeah. I just want to say you're cutting out a little bit. I don't know if it's just my hearing, but it's
Oh,
coming in and out just a
am
little
I?
bit.
Okay.
Yeah.
Did you get that question?
I did. I
Okay.
did. I am still on this healing journey for sure. I continue to go back to where I was because my brain got stuck there. But when I realized that rest wasn't enough, signs that something is wrong, I was having a very exaggerated somatic response to any time anyone said anything dental related, anything at all.
Hmm.
And I'm like, this isn't dentistry. Even talking about right now, I want to vomit. And things that happened to me were outside of just working in healthcare. Some things I won't share, but I had some other traumatic experience that happened in a healthcare setting. And uh, my brain just correlated things like clinical settings to this trauma. And no matter how much I worked on my mind, my body was just in this hyper alert overdrive. My world kept getting smaller and smaller. I was very irritable all of the time.
Mhm.
I couldn't find peace. When you have moral injury and PTSD, now for people that don't know me, I'm not a mental health professional. I am going back to get my master's in therapy. So I will be, but I'm not
Hey,
yet.
good for you.
Thank you. I'm just a person that really cares about people's holistic well-being. So I'm sharing from my personal experience of this healing. But for me, when I had really high intense suicidality, um, I realized looking into some literature on moral injury and PTSD that moral injury factor does increase people's risks of that suicidality because you have this guilt and the shame and a really hard time forgiving yourself. I felt so disgusted with myself and I didn't know why. I hated myself so deeply and I didn't know why. So uncomfortable in my own skin. I don't know why. I'm so full of unworthiness. I don't know why. So if that resonates with people, it's like,
Mhm.
I there's all these reasons where we're set up to experience those things in medicine and we're not given the space to process through it.
Yeah. So where did you get help?
The VA, actually, I got this really extensive workup for PTSD and it really validated for me. I was like, oh, if you're not going to diagnose it, she's like, clearly, certainly have PTSD. And now I'm in trauma therapy and it's hard and makes me sick and it's exhausting. And if I didn't do it, I would avoid and use, you asked me a little bit about utilizing food or avoidance of food to cope. Well, if people don't resonate with that, it could be substances, overwork. I run a lot. Compulsive running can be a
Mhm.
maladaptive coping skill. We do hear about people utilizing alcohol or medications that maybe not be as prescribed, opioids, just anything to help numb the discomfort of our
Yeah.
current living situation.
I mean, I think that even if you're not suffering from anything significant, we all do that. Even like the moment you get bored, you're scroll like it's the
Yeah.
constant trying to numb, coming home, having a drink after a crazy day. There's a lot of that in our society.
Yeah. Yeah. Some of it's been normalized and it may not be the best for us long term. So I feel like accepting and awareness, like awareness was the first step. And then I'm in this current state of accepting. And I chose to start the therapies before I had actually accepted the diagnosis. I was still resistant, but I
Mhm.
knew I needed to try something different because my life just I watched it get smaller and smaller and smaller.
Yeah.
and feeling like a prisoner in my own home, which wasn't a long-term
Yeah.
success plan.
So tell me about, because I know you obviously did a ton of therapy, but you also then went on and did coaching. So tell
Mhm.
me about a little bit about that and the differences between those and how they played in to your healing.
Yeah, so I started coaching after I had been in all high levels of care for my eating disorder. And I was in inpatient unit. And for people that don't know, there's inpatient units, there's partial hospitalization, intensive outpatient, outpatient. I was like, I am just not getting where I need to go. And I felt like I was having a spiritual crisis. My journals kept going spiritual crisis, spiritual crisis, spiritual crisis. And I just felt that I was having somatic reactions, and all these things aren't necessarily targeted, or there's not time, or the eating disorder treatment centers weren't a good fit for me to get all of that holistic healing. And so when I heard about coaching, I was critically ill with my eating disorder. It was 2021, like people were sick with COVID and uh, all the stress from that. And I had hit a rock bottom with my eating disorder again. And this time I wasn't in the military. I had just left a job that wasn't a good fit for me. I was very isolated and alone. I was sold all of my stuff. Like, I was not in a good mental health state. And it put me in that state of desperation to try something different.
Hmm.
And I heard physicians talking about coaching was really helping them. And I looked into the programs that most people were doing, and it wasn't aligning with what I felt like. I was just intuitively, it just wasn't a good fit. But then I found Martha Beck and her work, and The Way of Integrity is her book. And I resonated. Her story aligns a lot with my own.
Yes.
And yeah, so I dove into all of her books and Brene Brown's work. And I did coaching for my own healing, and also to learn how to better hold space for patients with cancer, because I
Mhm.
felt that we're not really equipped with that in medical school unless you do palliative care and hospice training in
Right.
particular. So that's how I started. And then when I got to my current institution, I switched jobs. I then moved across country. That fresh start that you think, oh, this will change everything. I brought my
Right.
brain with me, but coaching was there. It was helping me. I went to a burnout committee meeting, and they were talking about email etiquette. And I'm like, wait a second, we're losing physicians' lives to suicide, and we're talking about email etiquette. Like, I feel like we need something more. And so I asked my chair, who is helping to lead that group, is there a role for coaching? Just happened to be that my institution is very strong in coaching. We have internal coaches. I was able to fast track my way into training to become a coach through their program. It's Coach Rice, in affiliation with my institution. And uh, I help myself as I was helping other people in my institution. So that's all how it all happened.
That's great. Isn't that what we always do, right? You find something you end up sort of struggling with, and then you learn it, and then you teach it, and it becomes your mission.
Absolutely. Yeah, especially when you see the depths of pain that people are experiencing, and that agency that coaching provides, that this part's in your control, that part's not. Let's focus on what's in your control while validating the stresses that are impacting you that are outside of your control. It's that agency that provided me personally hope, and like, wait, I can control aspects of my life. I am in the driver's seat, because when you're stuck in a system, you just feel that load. It's all on you, and you people often feel trapped and they have no control over it.
Mhm. There are so many different styles of coaching. I like how you looked into them all. Martha Beck, she's something. I really
Mm.
enjoy her. I wonder, I'm going to throw something out at you, and I wonder how you would feel about maybe giving the listeners a taste of what it's like to experience either a coaching intake or a coaching session. Not right now. Maybe we could do like a separate interview, and you could coach me live on as a, what do you think?
Yeah, that sounds great. And I'll say typically it would be great to start with that coaching intake, explore what brings you to coaching. As you asked before, is this appropriate for coaching or therapy? We get to know each other, what your goals are, and really explore where coaching could play a role.
All right. Well, I'm saying that, I'm throwing that out. I don't know that I have the guts to be quite as vulnerable as you have been with me today, but
Mm.
I'm willing to give it a try. And after we have this call, we can try and set something up and test it out.
I love it. And expectation, right? As you get to know your coach, oftentimes I recommend people have that meet and greet, see if it's a good fit, develop that rapport with your coach and open up as you feel comfortable and safe. Because if you don't feel safe to be vulnerable in those moments, like pace yourself, take your time. Because my fear is if people push themselves to be overly vulnerable and they're not in a safe space, we don't want to re-traumatize ourselves. We want to make sure you're in a good community, a good relationship, if it's a one-on-one situation where you feel it's the right time to process through things.
Yeah. I want to ask you a sidebar question about your hospital admission, if you don't mind. I have a friend who actually had an eating disorder as a child,
Mhm.
and then as an adult, she relapsed and went back to the hospital and shared with me that really nothing has advanced, nothing has improved, nothing has changed, that the support she felt like, what do you feel like you got what you needed? Is there a lot of room? Because I don't know much about what goes on in those admissions.
And
Are the patients getting what they need?
yeah, so there's one thing to know, inpatient unit care is not there to provide you holistic recovery. It's there to medically stabilize you
Mm.
and get to you to a point of medical stability where then you could be successful. So oftentimes if we're not medically stable, our brains aren't functioning very well. And so there's not typically a whole lot of therapy there.
Mm.
Unfortunately, due to insurance reason, they often discharge patients prematurely, so they're not actually at a appropriate state to be successful according to what our literature shows in the United States. And I can only speak for the United States, but I know other countries have a hard time with access to care too. And so ideally, they'd go from an inpatient unit to an intensive out or to a partial hospitalization program to an intensive outpatient to an outpatient, depending on how well they're progressing in time. But I don't know if traditional care is, it's sometimes a one size fits all approach, which isn't, an approach that I find to be favorable for many. And what might have sustained a person's eating disorder when they're a child could be quite different from what's happening as an adult. And so sometimes people are like, I can't believe I'm dealing with this still. And it's like, not still, it's like maybe again. And if you've had an eating disorder before, you're at risk for it, coming up again. And for me, mine, when it flared up quite devastatingly in my adult life, it was from very different things than what you might face as an adolescent. Um, or at least in the chronology of my own life. Unfortunately, some adolescents might face some really horrific things earlier in their life. But you are right that eating disorder care hasn't drastically changed too much over time. And that's because there's often lack of funding in eating disorder research. And I find, unfortunately, there's a lot of trouble with access to care. That's partly insurance driven. And also the DSM criteria does a disservice for many patients because it sets these criteria that invalidate a lot of people who are struggling that may not meet certain weight measurements or things that are actually not correlated to severity of their eating disorder.
Yeah. You bring up the point that um, makes me think about it as the external, like that the eating disorder is more of an external presentation of an internal, right? And so we focus so much on fixing the weight and the behavior and the, but if you're not getting to the root cause,
Yeah,
right?
and there's many root causes for many people, right? And sometimes, there's studies that suggest there's a genetic component and a metabolic component to eating disorder. So I was just at a psychiatry symposium where on the slide, the person who does eating disorder research, she said eating disorder recovery is often an uphill battle against your biology. And so it's very exhausting in my own brain because I was talking to a group of individuals who are also in eating disorder recovery. And they were talking about, yeah, my friend just said, eat intuitively. And like, if I ate intuitively, I would be dead. Like I have to eat intentionally because intuitively,
Yes.
I would not want to eat it all. Right. It's like, so your cues and your body are all messed up. And oftentimes, and also I think for me, there's just so much trauma in my body that a lot of my behaviors are to really just expel the energy or to numb the energy from the overwhelming somatic reactions to those things that happen, which is largely why I'm a huge advocate for looking into somatic based therapies or trauma focused therapies. For many people, our society is just so full of trauma,
Yeah.
and I find that people might minimize what they've experienced because we can always compare it to other things that feel to us more traumatic.
Mm-hmm. Wait, so what would be an example of a somatic therapy?
You can do like the eye movement, EMDR.
Mm-hmm.
There's even somatic movements such as yoga. There's somatic IFS type of coaching therapy. Sorry, not coaching. There might be coaching too. I don't offer either of those, so you might look in to
The
see who's
IFS
available.
meaning the internal family
Family
system.
systems, yeah.
Mhm.
And even doing, I as a runner, I know that some of my running is um fueled by energy from the traumatic experiences, right? And so I can compulsively run, which isn't healthy. And so I say that because movement can be great, and working with a therapist that works with you to make sure that the movement that you are choosing is actually in alignment with your healing and not a way to hate yourself. Like I used to really use my self-hate towards running as, in a way that wasn't conducive with overall wellness.
Yeah. There's so many different types of therapy. Doctors don't even know all the different types. I don't know how
Yeah.
patients navigate this
Yeah.
world of and so
There's
much
so
of it
much.
not covered by insurance.
It's true. Yeah, it's true. And a lot of people do well with equine therapy with the horses.
Mm,
And they do breath. So anything that brings up trauma, I do want to caution people, go at your own pace, work with a practitioner who is skilled in that, because it can be overwhelming. Some people have gone into psychoses when they're on silent retreats, or had individuals that do dance therapy and it spurs seizures, like it in terms
yeah.
of just so much. So I'm cautious just to recommend any for anybody in particular. I don't know their story, but I do recommend easing into it, because one thing I did was, high achievers want to just dive
Right.
into the
Yes.
deep end, and that was counterproductive because then I flooded myself. So
Yeah. Pace
pace
yourself.
yourself.
And also, there are even a lot of people who, everybody talks about breath work and mindfulness and all this stuff. There are people who, when they pay attention to their breath, they actually have panic attacks. They
Yeah.
can't
Mhm.
focus on their breath. And I don't know where that comes from, but that's a real, and there's nothing wrong with you. That's
Yeah.
something.
Noticing that,
Yeah.
right? Yeah. Inviting with curiosity, not judgment about what comes up. Recognizing when I pay attention to my body. Well, somebody with an eating disorder like myself, uh, paying attention to my body, I did embodiment coaching and I want to fly out of my skin. It's like, this is not great, and okay, now I'm curious. Now, what are my next best steps in order to experience that on a
Yeah.
level and meet myself where I'm at? And so it does start like, oh, I'm noticing. And if I do breath work, I am going to have a panic attack. I wonder what that's about, and process through with a trusted therapist that can
Yeah.
support
Yeah.
you.
Our heads are so detached from our bodies. There's so much
Yeah.
work to do to pull it all together. Yeah. So, Jillian, what are you doing now? I mean, you said you were maybe getting a master's. I think you mentioned something about possibly psychiatry. What's going on with you?
Yeah. I was going to do psychiatry residency, and I was really nervous about that because, of the challenging times I had in residency, and I was gearing up to do that. And I talked to many people like, why don't you do master's in therapy? And of course, my ego mind was like, because I should do the residency again. But
Right.
then I was like, actually, what I really want to do is to provide psychotherapy and actually learn more trauma informed type of approaches to therapy. And so the therapy track, the master's in therapy, actually aligned quite well with what I was seeking to do. So I'm going to be starting a master's in therapy rather than going to psychiatry residency for now.
Yeah.
Best next step. I'm never going to take that off the
Right.
table because I had been considering it for so long. And I'm currently finishing a research fellowship. I work in radiation oncology. I do head and neck cancer research. So really focus on the psychosocial aspect and quality of life of patients with head and neck cancer.
Nice. Well, I'm hoping as a pediatrician that the HPV vaccine puts that out of business.
I know. Well, yes, I am agree with you. Maybe we can have some PSAs about that. And I am coaching still. So I wanted to say for anyone who is interested in coaching and have questions, I'm not here to solicit coaching clients, but if they have questions about what coaching is and they're exploring it and they're skeptical, I love answering those questions to see if it's right for you. As we're both coaches, we know I'm not going to tell you what's best for you,
Mhm.
but I know it served me so well that if you have questions about coaching in general, I'd be happy to answer them.
Yeah, and that's why I think it might be fun for us to do that follow-up
Yeah,
session. So we
definitely.
could
I'm
look
looking
into
forward
that.
to it.
All right. So let me ask you, anything I didn't ask you that you think would be really important for people to hear?
Well, for anyone who is stuck in that not enoughness, unworthiness, feeling that they have to chase all of the achievements in order to gain some sort of sense of value in the world, I just want them to know our society drastically leads us astray from what really matters. To give ourselves permission to pause, and you might experience grief that you're led to believe that you had to do all of those things in order to be worthy, because you're worthy just as you've always been. And those achievements might actually be driving you away from the things that will bring you peace and happiness. So, permission to create a life that's true to you.
Oh, that's beautiful. Thank you so much again for joining me.
Thank you for having me. It was fun. And I'm looking forward to our next stage of this journey and to seeing how vulnerable you wish to be.
All right. All right. And again, a great big thank you to our listeners for choosing to spend your very precious time with us. I hope to see everyone again on our next episode of Reinventing the White Coat. For this episode of Reinventing the White Coat, if you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.